This computer.
Hey everyone, happy Wednesday. I am so happy because the weather is absolutely beautiful in the Chicagoland area. We're in the 80s this week. It is so cool. But you know what? Deb and I and a lot of our friends are getting to that age where we got to start thinking about Medicare.
Right.
And it's overwhelming for a lot of people because there's all these parts and this, that, and the other thing. And so we thought we would do a thing on it and do some research and try to help people so they understand a little bit what's going on. And I know Debbie met with somebody for her in-laws and she got a lot of information. So Debbie, I'm gonna hand it to you. How are you today?
I am doing great, and I gotta just tell you that, just a little disclaimer here. We've had some computer issues. We're trying some new platform stuff, and so everybody, thank you for being so patient.
Yeah,
We are really at that age, like you said, and I did meet with somebody, and we were doing it primarily for my in-laws to help, like, actually go over their stuff. So part of the
hmm,
message we want to convey to you guys is that if you're younger and you're not approaching that, but you have parents that are, encourage
yeah,
the parents, the in-laws, the aunts, the uncles, whoever it is, to revisit their plan, because a lot of times they're not. They're just taking it for granted. I signed up for this and it's part A, B, this, that, whatever. And they're not getting the maximum amount of benefit that they could potentially be getting. Okay. So what we learned is that there's a lot more options than there were years ago. Okay. And so like for
yes.
us, and we have a guy that we met with, and he's really great. His name is Juan. I'm actually going to put his card on the comment section, a picture of it. So if anybody's interested, if you don't have anybody, but he is so patient and he is so good with what he does because he actually explains everything very good. So I took a lot of notes. So I'm going to kind of read from my notes. I'm going to talk fast for a second and I'm just going to do a very quick overview. I am not going to go through and really give you too much, guys, because I want this to encourage you to go and take action. Take action of your own situation. So first of all, I want you to know that if you are like Lori and I are 62, okay, so 65 is when you actually can start doing the benefit, but you have to be prepared ahead of time. So you should really be at least a year ahead of time researching and having your idea in place of what you need to do, because 2 months, 2 and 3 months before you turn the magic date, you can have it all in place, all signed up, so that the first date of your birth month, so I'm born on the 14th, so December 1st will be my first date that I'll be able to have the whole entire month. So if you're born even on the 31st of the month, you can start at the first of the month, so you gain that time. And so if you're not at the Social Security situation and you're not getting Social Security and you're still working or whatever, you're going to have to pay out of pocket. Okay. And you have to pay out of pocket based on your last 2 years' income. And you're going to pay anywhere from, they said, $165 to $500. And he said $500 would definitely be somebody who's at a very high tax bracket. So, that kind of thing. But you're going to pay that. Okay. And you're going to have very good coverage. But you have to make your choices based on what's right for you. And what made a lot of sense, and that's why I'm only going to say it very general because there is so much. There's your part A, there's your part B, there's also your supplemental, which is going to be something that you're going to want to have along with prescription coverage. So you're going to have a part D, and your part C is your A and your B are your illness and your accidents and your hospital stays and things like that. But then when you add in that part C, a lot of people, you hear, oh, I have a supplemental. Well, I know that right now my in-laws are paying out of pocket for a supplemental and they don't have to. That's the big change that I'm learning. Okay. And again, please, no, I don't know this extremely well. I know it well enough. So a lot of the advantage programs are where they're talking, and these advantage programs are kind of like having a PPO. Now, what'll happen is you're not paying for that extra insurance. Medicaid has a relationship with them, and so then they work on everything back and forth. But then you're going to pay a co-payment, but you're going to have so much more benefit, but you only pay a co-payment till you get to a certain out of pocket. Okay. And I'm not going to quote any numbers because, again, it could be different for everybody. But when I ran the numbers based on what we're paying out of pocket, what we're paying now, and when we will turn 65, the savings was incredible. And
Yes.
if you go into the hospital with some of these advantage plans, he was telling us, and you're going to have to pay a daily rate for only a certain amount of time. And then after that, you're not. The daily rate, maybe let's say that your daily rate is you have to pay $200 out of pocket, but that next day you go into surgery, your surgery is 100% covered. So there's a lot, there's the advantage of stuff. There's so many things, also included in that. You're going to get some hearing aid coverage, and you're going to get your hearing aid stuff is going to be covered. Your dental is going to be covered, except for implants. But if you have, certain things, and there is a cap on some of it, but you know what, there's a cap on it on all of it. And then also for glasses, you get so much for glasses and contacts, which, is nice. So, I've never had dental insurance. I've never had eye insurance. So this is going to be a nice thing to have. And again, some of the things that, yes, this is another important one. And then I'm going to turn it to Lori, because then she can definitely remember, because me and Lori had a pretty good conversation about this. And if I forgot something, there's some other thing that they give you where you have $100 and some every X amount of time. I'm not going to quote it, but it's a shopping thing, and you have to go online for it or call this number, and you can get items. Okay. So maybe the items and they have to be health orientated and things. And there are some food items. And because of these plans, you're getting them. So it's kind of like free items, kind of like a free, like discount card situation up to a certain amount. So, as much as I like, okay, if you're not getting older, you're not here, right? That means you're not here, but we're getting older and we have to think about this. But again, the conversation we're having right now could pertain to you needing to help someone in your family or friends, So with that, Lori, I'm going to turn it to you and yeah.
Debbie, you couldn't have said it any better. One of the great things that we have found, see, Gary's on Medicare and I'm on Medicare and Medicaid because I'm disabled. So let me just explain that real quick. Medicare pays for a lot of stuff, but whatever Medicare doesn't pay, Medicaid pays. So I never have to pay for anything. My prescriptions could be $5,000, $6,000, $7,000 a month. I don't have to pay nothing, and that's great. But as far as with Medicare, you do have to pay some kind of a copay for your medications. But I want to go back to one of the greatest perks there is for having the Medicare Advantage is they will pay for a health club. And I don't know if anybody knows this, but we belong to what is called Lifetime Fitness, which is a very exclusive, very posh health club. You feel like you're on vacation when you're there, and it pays 100%. And normally it's like $100 a month for membership. And we're both getting that with our plans. So it is just great. They have an outdoor pool, an indoor pool. They have what they call silver sneakers. And if the health club has silver sneakers, then you'll get a free membership. So we really enjoy that. Now, as far as that $100 that Debbie was talking about to go shopping or whatever, in our cases, we have a book. And you know what? I've never even used it yet. I am so bad about it, but it has a list of all the things that you could buy, from Band-Aids to some over-the-counter medications, all kinds of things. And you know what is really amazing is that it will also pay, and I don't know where that comes in the plan, but it will pay 100% for incontinence stuff like Depends, 100%. And it is just amazing. So I was listening today to something on YouTube, and do you know there's hundreds of Medicare Advantage plans? Debbie, what did he say was the best one to get?
Okay, so he personally said Humana, and I have heard that from a lot of people, but I want to tell you guys, like, I mean, we don't want to, this is like a situation, we're making a big decision. So we're giving you the checking your due diligence. Okay. Yeah. But also, can I just interject
Yeah,
something else?
no, go ahead.
Oh, I just forgot it too. What was it?
See, we're getting old, can't you tell?
Oh, I know. It's so crazy. Oh well, maybe it'll come back to me. But yeah, but you were right on with what you were just saying. So important, about like
Yeah,
the silver
it
advan
is.
silver sneakers and stuff. You know.
Oh, yeah, because they want people to stay well and
Yes.
stuff. And
Oh, I know. You get points for being healthy, doing good stuff. So if you can track your progress through like a Fitbit or something like that, you get gift cards and perks for
yeah,
those. Okay, so this is crazy, you know?
yeah, that's true. Because I have gotten gift cards.
Right,
Like, for example, if you did your mammogram on time or
right,
your colonoscopy in time,
right.
they will send you a gift card for like $25.
Yes,
We don't live the plan to get that. It just all of a sudden it comes in the mail.
right.
They will remind you of stuff all the time. They really want you to stay healthy, so they have no problem. Like with vaccines or any of that stuff is all taken care of. But like Debbie and I have talked numerous times, you still have to be an advocate for your own health. It is so important.
Huge.
Um, a lot of we've talked about this before. I know for many years I did not take care of myself, and I'm paying for it now. And that's why I say you have to be an advocate for your health. And these insurance companies, with Medicare and Medicaid or just Medicare, they make sure they'll send you a note and say, hey, you have not had your mammogram. Hey, you haven't had your colonoscopy. And so, that's a great thing. But like Debbie says, I feel that you should not take and do this at least the first time without meeting with someone.
Oh,
Now,
yes.
we get that information.
Yes.
We're both fortunate that we knew people that knew people.
Right.
So I'm sure if you looked up, I think most people that deal with insurance deal with Medicare or Medicaid too, Medicare.
Yeah, and I do want to say this one guy, Juan, he actually deals with different states. So I know we have a lot of different people in here that are different states, and he is licensed in a lot of states. So I am going to put his name and number up there, and just to give you guys the offering of having that, so that you can like, in case you want to refer back to it. But it's good to know, you know.
Right. And another thing too is, you get freaked out thinking, oh my God, I'm going to do this and I'm going to be stuck for life. No, every year there's that like a month and a half where you could go and change your plan. And I think it's usually beginning of October through like December 7th. I don't know the exact date.
October 15th to December 7th, but I want to tag on to that. The very first year when you sign into something, and anytime
Yeah,
the first year, like you have 12 months, that in
yeah,
that 12-month period, if you are very unhappy with it and want to go back to something different, it's allowable to change. And that's
yeah.
really good because there are people that could make a poor choice. You know what I'm saying? So,
Yeah, and it's easy to do. I know we had
yeah,
with Gary, we had just the regular A, B, and D,
yeah,
And then I was like, whoa, you're paying too much. Let's look into these Medicare advantages. And his doctor was in there and everything was fine.
yes,
Um, I know that some hospitals and some doctors don't take the advantage. That's the difference. They'll take basic Medicare, but a lot of them, they are very choosy of Medicare Advantage plans. So you have to get a hold of your doctor, find out all that information before you sign up. Did
right.
you hear anything like that when you talked to Juan? Did he say anything about that?
Yeah, no, well, like, I mean, here's the thing. I think that he said that almost everybody is taking this stuff now, you know what I
Yeah,
mean? So I think that
right.
like it varies, of course, but I think that you again, Lori nailed it. We got to be your best advocate, you got to be your own advocate. You got to make sure that you're like, checking everything out and doing your due diligence, and then, use your best educated advice from the person that you trust, It's just like you wouldn't trust your taxes with somebody that you wouldn't be doing the
Right,
best for you. It's the same thing now. It's like you have to shop everything. It's so, and there may be people out there that, like, if you're still a working employed person and you're still getting, insurance through your employer, I believe you can not take it, but don't quote me again. I think because maybe you have something going on that's really good, but again, you have to just, make sure that you are
right,
accurate information and stuff. And with that,
right.
I think go ahead. Go ahead.
I just say that's great that you hit it on the nail right there. Right, exactly.
So I don't think I have anything else. I'm just if anybody sees, we're kind of, not that we want to be rushed, but we had to do a little format change here, and we're going to have to download this and put it on our page. Maybe what we'll do is for future, maybe, record ahead and just if we have this issue again, but we had an echo issue.
Okay.
And maybe anybody out there that can help us. We're having an echo issue.
Yes.
So, but
Yeah, yeah. Somebody who doesn't want us to talk about this, but
I
we
guess,
really
right, right.
talk about this.
But anyways, but yeah, so I'm gonna go ahead and say, Laura, do you want to close us out? And
Yeah,
then
you do.
okay.
You guys have a great week. Enjoy the weather. Fall is here. I think tomorrow's the first day of fall or two
Is it?
days.
Oh wow. Okay.
So with that, I want to say have a great day. And Debbie, I'm Lori,
And I'm Debbie.
and we're friends helping friends. I hope we helped you out
Okay.
today. Here, God bless.
Bye bye.